Really, really weird time. Okay, now we're live. Good evening. It is Monday, June 29th, for those of you who are wondering what day it is, 2020. And I'm delighted to welcome back Kim Parsons of the Kim Parsons Consulting Group. Kim is a healthcare industry consultant specializing in health literacy, human design, and experiential learning techniques. She leads discussions and workshops featuring sessions to stimulate innovative thinking for healthcare professionals, but today she's going to help stimulate innovative thinking for us patients, who are really the core, the center of what healthcare is all about. And I like to say that the people who care for us in healthcare often unwittingly make decisions for us without us. So Kim, um, last time we were together, we spoke about health literacy. Would you just give a recap on the definition of health literacy?
Right. So health literacy, and hello, good to be with you again. So health literacy is defined as a person's ability to obtain, process, and understand basic health information, and then be able to take that information and use it to make appropriate health decisions. I'm not a big fan of that definition because that puts all the onus on us as individuals. The system is far too complex for us to ever be able to process and gather all that information on our own. So I think it's really incumbent upon the industry itself to, be health literate organizations, do health literacy best practices so that they show up in a way that we as patients, as individuals, can navigate it so much easier. And I'll just remind us too that the American Medical Association says that health literacy is a stronger predictor of health than a person's age, income, education level, employment status, right? So health literacy is something that affects all of us, some more so than others, right? If you think about seniors, the uninsured, maybe people living in poverty, immigrants, others, have a higher issues with health literacy. But really, it does affect all of us. A quarter of the US population has low health literacy. So 1/4 of the US population.
And I think that I may be one of those people in some circumstances, and particularly when you are under duress or stress, as we are now in our country with the concerns about the COVID virus. And then you add cancer on that, and you just have almost a perfect storm that it makes it hard to understand things that you might understand in more normal circumstances, whatever normal is. So today we were going to talk about numeracy, and that's another ACY word that ends in ACY. We have literacy and we have numeracy. Obviously, that's to me the study of numbers, but as it relates to health numeracy, can you please define what that means?
Yeah, so when you think of the definition of health literacy, then just think of numeracy, then think about, well, it's your ability to take quantitative information, right? It's to be able to take that and to be able to make health decisions about it. It's about being able to perform routine tasks and actions, right, that maybe are driven, that you have to do math or some quantitative techniques or some things, to be able to do. And some examples of that, just right off the bat, when you're obtaining insurance, right? When you're thinking about your plan, what you're picking and what the coverage is and the benefits, there's a lot of math involved in that, right? There are deductibles, right? So, and how you meet those deductibles, what counts toward the deductible and what doesn't. But then your co-insurance, right? 80% co-insurance or 20% co-insurance, whatever that may be. You have to be able to do the math, to be able to understand, what all of those costs will really be and add up, well, it's my premiums, but it's also my deductible, it's my co-insurance, it's all those things to be able to really get a clear picture of the true cost of your insurance. Another example is like with prescriptions, right? So when you're following dosing instructions, and I'll give an example of that later. But then to think about, let's say, lifestyle choices or maybe lifestyle modifications that you need to make. So let's say if you maybe are diabetic, and then so that's like understanding blood glucose levels, right? Your blood sugar levels, and how maybe how much orange juice I'm taking in, how that's going to impact my blood sugar level, and then what does that mean in terms of the amount of insulin that I'm going to need to take and give to myself. There's lots of math involved in all of that. And then so one, I would say that less numerate people really rely on their emotions more to make health related decisions, and some of that can be, I think, because of the maybe sometimes a fear of numbers, or just in the moment I can't process all of that, I can't think about those kind of numbers, right? Just like you said, it's you're sick, and someone's giving you a lot of information and you're having to make decisions. Well, now you want me to do computation as well, right? So when you think about that definition, Molly, and some of the examples that I've given, how would you think about that, how numeracy might impact someone with breast cancer?
Are you asking me that question?
Yes, no, I was just thinking like how,
I think in the beginning with breast cancer, your stage, you have a stage 1, 2, 3, right? That's numeracy.
Yeah.
They need to define what that is. Also, when you have chemo infusions, there are amounts that are numbers. So you need to understand the range potentially of your treatment. Some people get lower doses of chemotherapy based on concerns about toxic side effects. Some people get higher doses. Sometimes it's based on how aggressive the cancer is. I don't know, frankly, having not had chemotherapy, how important it is to understand that piece. But I do know that when people give you percentages around something versus numbers around something, that's hard to understand, and particularly if they interchange those things. So it would be important to me if somebody gave me a percentage. So I'm going to make this up. So, of 100% of a chemotherapy drug that you could receive, we're going to infuse you. And I'm making this up because I'm not an oncologist, obviously, and I haven't had chemo. But we're going to give you 75% of this and 25% of that. And I would want to understand a little more. Is it important that I understand weight or ounces? What's really important is I understand how that's going to affect my treatment outcome. When I was finishing up treatment and offered either tamoxifen or Arimidex, they talked about percentages of risks for developing blood clots or weight gain or bone pain or on. And I couldn't get my head around that. So I entered a clinical trial because I wouldn't have to decide between the two.
Yeah.
And basically, it was, for me, a toss-up. I couldn't understand it. And they did try to equate it to the number of women based on these percentages, but it wasn't clear to me.
Yeah. Yeah, risk is I think risk is a very hard concept for anyone to understand, but particularly when it applies to your health and when people, as you say, are talking in percentages, right? An X% chance that this drug will be effective, or that this, avenue of treatment works for, 70% of the people. And as you say, when people talk percentages, then you have to do the math, and you have to say, okay, so 70% of the people, that's how many people then, what does that look like?
Especially if the numbers are high.
Right. So it's better if you can say, 3 people out of 10 have this,
yes.
Impact, right? So that you're not having to do the computation.
So if I'm a patient and a physician or navigator, anybody gives me that kind of data, what can I say back to not appear stupid? Because people are afraid of appearing uninformed. They're embarrassed. They're already upset that they have this cancer diagnosis. What language can they use to ask the healthcare professional to explain this to them in another way?
Yeah, that's a good question. And I think, well, one, I think that we are even more timid about asking questions when it involves math, when it involves, those sort of things. Because again, like you said, you don't want to appear like, well, I can't do basic math. Well, in that moment, you shouldn't be expected to, right? So you need to ask them to break it down for you. And I'll give you a couple of examples. So, and I mean, this is a very simplified example, but let's say a doctor is talking to me about my weight. And if I could reduce my chance, of getting diabetes, if I can lose weight. So when you think about that, there are a lot of quantitative terms in there, right? Even though there weren't any numbers that were mentioned. So I need to lose weight, but it wasn't specific as to how much. It's going to reduce my risk, but not specific to how much, of getting diabetes. So if you can say, just break that down for me, right? How much? Ask them, to use specifics instead of words like small or decrease or reduce or chances, right? Really, a better way to say that to me, to give me more useful information, is to say, Kim, if you lose 20 pounds, that's going to improve your blood pressure, right? Which will make you, less likely than, to have a heart attack or to need blood pressure medication or whatever, right? Another example would be maybe, around prescriptions, right? When you have dosing instructions, dosing instructions that you need, it's easier to understand 20 pounds than say, processing a certain amount of my body weight. And then when you're thinking about blood pressure readings, blood glucose levels, those sort of things, there's lots of numbers involved in that as well. So when you're thinking about interacting with a pharmacist, maybe with a prescription, where
your weight.
We were brought up with teaspoons and tablespoons and cups, and right, we have our American system of talking with things, but in the medical world, right, it's all about milliliters. It's all about and so you're no longer talking about a teaspoon of medication, and so there can be a lot of dosing errors that are happening if you're not using the maybe something that the pharmacist can provide that will have those very specific marks on them. I don't know about you, but I don't have that stuff around my house, right? And I have the teaspoons and those sort of things, but I don't have the things that a pharmacist or a doctor would use to measure those amounts.
So I have to jump in here. My children's father, years ago, when one of my children was sick, and he, by the way, he went to Harvard. He has like 164 IQ. You would think he would be able to read and understand things, was to give the child Tylenol, that pink goopy Tylenol. And he thought, well, I should just give her twice as much because she's got a higher fever. What? He didn't, twice as much should be better.
Right.
No, it could be toxic, but it's just so curious what we don't know and things that we assume. So I know I use the example of when another daughter of mine had a C-section, and the dosing instruction in the hospital was 2 tablets every, I don't know, I'm going to make it up, pain, every 4 or 6 hours. I don't know what it was, daily. So, but she got home and she kept taking that way, but she hadn't read the bottle. Nobody said to her, we're changing the dosing.
Yeah.
And so she ran out after 2 weeks and had to just suck it up because they weren't going to prescribe anymore.
So I'll throw a percentage out at you after I've told you to, tell people not to use percentages with you, but that is that about 52% of patients, when they're asked, tell me how you would read this medication, read this medication label, tell me how you would take this medicine. You have about 52% of those responses have errors in dosing amounts in terms of what you would do.
Right. So you go to the pharmacist. Now, I am very fortunate to not take any medication at all at this point in my life, and I have never had to take regular medication. So you go to the pharmacy, you're at the counter, and the pharmacist asks you if you have any questions, right? They sometimes they go over the dosing instructions. It's written there, but it's like pages of side effects and small print. You can hardly read it without a magnifying glass. So I wonder how many people at that point don't ask because, again, maybe the doctor told them, maybe they're embarrassed, maybe there's a line behind them, they weren't even listening so that they feel stupid. So I think this kind of goes to active listening techniques, starting at the very beginning. When the patient hears something they don't understand, perhaps the best recourse without thinking that you're appearing stupid or questioning the doctor and wondering if the doctor or a healthcare professional is going to be insulted by your question, which I don't think they would be, but would be, this is what I heard you say. Am I right? Or this is what I understood you to say. Is this correct?
Right. And
rather than I don't understand, I think I think an active listening technique would work really well.
Yes, it does. And in fact, the physician or the pharmacist should actually engage you that way, right? It's called the teach back method. And so after someone gives you instructions, just to clarify that they said what they meant to say, right? They should ask you, so, tell me then, how you're going to take this medication, right? And let you repeat back what it is. So that's another way of doing it instead of, is to say to them, as you're saying, well, let me tell you what I think I heard you say, or here's what I heard, right? And then, we often complain that when we go to the doctor's office, right, you have to fill out a form and they ask you all these questions, and then you have your interaction with the nurse and she asks you the same questions, or he asks you the same questions, and then the physician comes in and she asks you those questions again, right? Well, there's a reason that they're doing that, right? Because, your story is going to change a little bit each time. And so, sometimes they're getting more information that way, or validating that they heard you correctly, right? So we need to do that for ourselves and go, well, that's how the system works, right? They're asking me the same thing all the time, different people, right? I'm telling the same story. So when the doctor gives you the prescription and they, say, this is what it is, let me repeat back what, how I think that this works, or what you said. When you go to the pharmacy to pick up that prescription, and they ask, do you have any questions for the pharmacist? Yes, can the pharmacist walk me through this? And then repeat back to the pharmacist. So this is this is how I'm going to do this now, right? Because it's not just clarifying your understanding of what they said, but also that, for them to understand, how clear am I when I'm giving these instructions, right? If I do teach back 3 times in a row and I've given the instruction the same way each time, but when the patient tells me back to me, it's not right? They're that's not what I want them to do. Well, then that physician or the nurse, the pharmacist, whoever, should realize, I need to change my language, because what makes sense to me in the words that I'm using is not coming across in the way that I intend it to the patient.
So this is just a side question, but how much training do physicians and physician assistants and healthcare professionals receive on numeracy and trying to help patients understand numbers and percentages, and liters and milliliters?
Yeah. So I can't speak to that because I'm not a trained clinician, so I haven't been through that. I don't know. I do know that, health literacy and numeracy, the talking about this and the impact that it has on us as patients, is a fairly young discussion, right? Really, I think it was 2004 when the National Academy of Medicine's prescription on how to end confusion about health literacy. So you think about it, it's really, maybe 20, 25 years, right, that we've really been talking about this at a national level.
So are there any online resources where we can learn what we can do apart from our conversation here? What could we refer people to?
Sure. So from I always will point people to the United Healthcare's Just Plain Clear, which is a glossary, right? But that glossary, deals with things like premium and deductibles and things like that. So it's dealing with numeracy as well, right? It's helping you to understand that. That's justplainclear.com. And then there's a medication adherence toolkit that the American Association of Colleges Pharmacy put out. Again, many of those resources, may be more clinical in nature, could be more, clinician facing, that type of thing. But again, they're the Just Plain Clear, that glossary, other resources like that.
So as a consultant, when you meet with healthcare professionals, how do you advise them in this area of numeracy? Or do you? Do they ask?
Yeah, so I think it's, again, it's the large conversation, right? Numeracy is a part of health literacy. Health literacy is a part of health equity, right? If you're not going to have the same care experience or navigate care in the same way, right? You're going to have equitable issues if you do not have a good understanding of the system, if you don't understand health literacy and numeracy. So go ahead, I'm sorry.
Well, so health equity, which is a big word, equity, people may think that's equal, which to some degree it is, but this really goes to the disparities in healthcare.
Yes, it is.
And in particular, some of the challenges that people of color or immigrants or people who English is not their first language are challenged with. So how do we work with that population?
Yeah, so and it's also women as well, right? Many
it is women.
Yeah.
We don't speak up as much as men.
Well, true, but also in terms of in terms of equity, right? In terms of the care, oftentimes when women present, for a heart attack, right, our symptoms are different than that which a man has, and so that's an equity issue, right? A health equity issue. If people aren't approaching us as a woman and understanding, what that looks like in a woman and how it's different from that of a man, right? If they just treat us like a man, then they're going to miss maybe when we're having a heart attack. But your question is how. And again, there's a huge discussion in our country right now, around equity and health equity as a part of that as well, and disparities and health disparities, right? And your question was earlier was, when I work with people or talk with organizations, when they're designing for people, right? It's very how you address that and keep from having those disparities and remember to use health literacy best practices and whatnot is really to have, the end user as a part of your discussion and as a part of your design. If someone is designing a health plan, and then a consumer should be a part of that, right? Different types of consumers, women, men, people of different ages, different races, different backgrounds, right? Because we're all based on who we are and what we know, what we've been exposed to, we're all going to have different questions. We're all going to have different approaches. So if you can, involve people, again, your end user, the real person, in those discussions, then you're learning what it is that they will need. What are the gaps, right? And as long as you're designing for, if you think of it, as like a bell curve, right? Most people are here in the center, right? But if you have super users on one end, people who are in the system all the time, right? Using their benefits, et cetera, all the time. If you have those people, and then you have people who don't use, the system very much, maybe don't interact with their benefits very much at all, right? If you have those two types of people at the table, and you solve for what the super user needs, right, and the low user needs, then the majority of the people, you're going to show up in the right way for them.
So I just want to talk very briefly about your explanation of benefits when that comes. It's really important thinking about numbers to make sure that the numbers on everything there, your address, those numbers are correct, your zip code is correct, of course your name is spelled correctly, that any patient ID number is correct, because that's where some significant mistakes can be made in billing. Mm-hmm. I know that some years ago, I had a code on a bill for a little cancer surgery on my nose, and it was billed as an emergency. And it was not an emergency, it was a scheduled procedure. Mm. So I asked about that. But it also, I called because the whole thing didn't make sense to me. So if you receive an explanation of benefits, and by the way, the prevailing wisdom is do not pay your copay or any of that until you get that receipt, which sometimes can come months after your procedure or visit, which is always shocking to me, right? Why do I sometimes get these things 5-6 months later? So you're looking at all these numbers on these forms. One of the things that your treatment will have a code number. Yes. And if you don't understand it, it's really important to call the financial people at the provider's office and ask what that code stands for if it doesn't resonate with you.
Yes, definitely.
Any tips on reading those forms?
Yes. So again, it's so confusing, right? Because it says this is not a bill, but here's what you owe.
Yes, right. Yes.
And you're right. The explanation of benefit, it's coming from your insurance company, right? Based on the doctor sent us a claim with this code on it that said, this was the treatment path, right? And then it goes through the Wonkinator, right, to determine how much of Kim, how much is Kim going to owe based on where she is in her plan and her benefits. Is she satisfied her deductible and all those things, right? And that's what comes out to you in the explanation of benefits that says, okay, it's gone through the system here, and and based on all things, here's what you owe. But it's good at that point that that's not a bill from your insurance company, and that's why it says this is not a bill. It's just the insurance company that needs to send you that information. So then you need to reconcile that with the bill, the actual bill that you're going to get from the healthcare provider. And that's why oftentimes you go, well, these things don't add up. They don't match, right? And so, do not hesitate. Call the physician's office. They may say, oh, yeah, not my fault. We didn't cause that problem, or this question that you have, your insurance company did. It doesn't matter, right? Where the fault lies. What's important is that you get it worked out, and that you don't end up paying more, than you're supposed to. And I'll have to say, when you're going through, cancer, and for 8 months after, one procedure, you're still getting bills, and you're still getting explanation of benefits, and there's so many different it's so hard to keep track of all of that. And so I think that you just need to not be shy. Talk to the provider's office, talk to the physician's office, and ask them to break it down for you, just like you would if you're asking them to break down the instructions that they're giving you for steps that you're taking for your care. Right. Ask them to explain it. And don't hesitate to ask them about their math as well, because systems make errors, people make errors, and I'm certain that when I had cancer and was going through that I probably just paid bills that I received, that now I think about it and I think, oh, I wonder if that really was a charge. Maybe I questioned it at that time, but I was just so overwhelmed, and there was so much that I just paid it anyway. And so I'll tell you that, take my advice, don't do as I did, right? But make those calls.
So just to recap, if you have any questions, United Healthcare is justplainclear.com is a good resource and tool. And I want to, it would be remiss if I did not say that the Pink Fund is a national breast cancer organization, which helps to mitigate the burdens of financial toxicity by making non-medical bill payments directly to patients' creditors. Our application is available online. And today's Facebook Live was brought to us by a grant from Exact Sciences, and we're very grateful for their participation in these series. So Kim, I know we have 2 more after this. Hopefully we won't have any interruptions that we've had before, but I thank you very much. Wish you a happy 4th. And we will follow up. This will be on our website, and there'll be a cheat sheet there for you to look everything up that we've discussed today.
Thanks, Molly. Look forward to talking to you again.
Okay, bye-bye.